it just doesn't honor underlying brain physiology. Also look at their response to medicine. You give them an SSRI like Prozac, and they say, I'm happy, but I have no motivation. Well, you can just bet you've taken down their cingulate gyrus too far. Okay, let's talk about treatment. So how do you treat anxiety, depression, and bipolar disorder? Seriously. I think that's important. You take these seriously. They ruin people's lives. Suicide is the 8th leading cause of death in the U.S., and it's the 3rd leading cause of death among teenagers. So don't minimize them. The first thing that I think is important to do is educate people. So, I encourage our patients to go to conferences, lectures, get really, really great books like the one I wrote. Get on good websites and learn about it. Support groups help. If you run a group for I used to run a group for people with anxiety disorders. I loved it. They were fun, and they learned a lot, and the social support was helpful for them. It's my support group. Yosemite, pretty place. Nutritional treatments, I encourage them to be on healthy diets because your brain, as the rest of your body, makes itself new every 5 months. So you literally are what you eat. So you might as well be putting good things in like blueberries and spinach and walnuts and broccoli and lean protein rather than milkshakes and pastries and Starbucks. And I'm going to get myself in trouble with Starbucks someday. The cingulate types do better with a more balanced diet, lean a little bit more towards simple carbohydrates. There's a wonderful book on that called Potatoes, Not Prozac. Supplements, we talked a little bit about them, but if you have low prefrontal cortex problems, we think of L-tyrosine as being very helpful. A hot cingulate, we use St. John's wort or 5-HTP. Limbic problems, SAMe or DL-phenylalanine. Temporal lobe problems, we use GABA. You have a cyclic mood disorder, and all the rest, I recommend high-quality fish oil. I take 2 every day. It's called Nordic Naturals Pro Omega. I think it's just got a great blend of the right kind of omega-3 fatty acids. I think it's very important to pretty much teach most of your patients this thing I call ant therapy. It's how to think in ways that are helpful. And it's based on some very simple principles. The first one is every time you have a thought, your brain releases chemicals. Every single time you have a thought, your brain releases chemicals. Every bad thought you have releases bad chemicals that make you feel awful. How do we know that? Well, we hook people up to biofeedback machines and we go, think about these 5 things. And if they're bad things, their hand temperature gets colder, their hands sweat more, their muscles get tense, their breathing rate gets fast and shallow, their heart rate goes up but flattens out. There's no heart rate variability, which is a sign of heart health. They've also done brain scans on people thinking about positive things or negative things, and what they find, that changes the brain. So what you think about moment by moment matters. When you have good thoughts, happy thoughts, hopeful thoughts, your brain releases a completely different set of chemicals that make you feel good. The Apostle Paul was right. Think on whatever is pure, right, lovely, good, excellent, worthy of praise. Let your mind dwell on these things. And it's a training exercise to bring your mind back to what is healthy. Because thoughts are automatic. They just happen. They're based on complex chemical reactions and memories, and they lie. And they lie a lot. Your patients and clients are filled with thoughts that just aren't true. But they have no clue because no one has ever taught them you don't have to believe every thought you have. They're just thoughts. I taught a class for 3rd graders once called How to Think. And it amazed me how these little 8-year-old kids were filled with negativity and erroneous thinking. And what do we teach them in school? We teach them how to factor before we teach them how to correct the bad thoughts that go through their head. This should be right up there with the alphabet, because it's what ruins people's lives. It's not what other people do to you. It's what you do to yourself. And it's really simple. You just tell people you don't have to believe every thought that you have, and I can teach you how to take control over them. So, this is Gary Larson on different personality types. Top left, the glass is half full. She's all excited. Healthy brain. Probably my mother. The guy on the right, the glass is half empty. He's angry. He's got limbic problems. The guy on the bottom left, half full. No, wait, half empty. No, half. What was the question? He had a cingulate gyrus problem. And the guy on the bottom right, hey, I ordered a cheeseburger. Temporal lobe problem. He forgot. This is what you do. You tell your patients, your clients, whenever you feel sad, whenever you feel mad, whenever you feel nervous, write out what your thoughts are. You write out what happened, what's the event, and then write out your automatic negative thoughts. And then see if you can't identify them as one of these species, one of these different types. One of my patients drew some of these for me. This is a mind-reading ant. Where you arbitrarily believe you know what somebody is thinking even though they haven't told you. I have to tell you, I have 25 years of education. I can't tell what anybody's thinking. A negative look from someone else may mean nothing more than they are constipated. You don't know. I know a lot of you think you're very intuitive. Right hemisphere, hey, big right hemisphere. Forget it. You can't tell what people are thinking. It's way too complicated. The next one is fortune telling. Your anxiety disorder patients, they're filled with fortune telling. Fortune telling is where you look at a situation and you predict the worst possible outcome. And then you don't stop there. You then make it worse. Guilt beatings, where you think in words like should, must, ought, have to. Now, of course, in life there are shoulds and shouldn'ts. Of course there are. But if you try to motivate behavior with guilt, it won't work. It's much better to say, what's your goal in this situation? Rather than you should do this or you shouldn't do that. So the exercise again, whenever you feel sad, whenever you feel mad, whenever you feel nervous, write out what you're thinking. So, one day we were seeing a patient from China. And I was really nervous. And I went, this is going to be really hard. And then I caught myself. And I wrote this down. This is going to be a difficult patient. And then I wrote fortune telling. How do I know? I haven't even met him yet. It's possible. It could be a really great experience. And then I wasn't anxious, because I was correcting the bad thoughts going through my head. So feed good thoughts to your anteater. You should go over to the UCI bookstore and buy yourself a little anteater. You know, that's their mascot. It's the anteater. You should buy yourself an and just put it in your office somewhere to remind yourself, one, when you feel sad, mad, or nervous, write out what you're thinking, correct it, so you can deal with the situation with better brain function. And two, it's a very useful analogy to talk about with patients. Biofeedback we talked about a little bit. It's very exciting, where you can teach people to warm their hands, breathe with their belly. Meditation is the same way. And it requires practice. It's like you have to do it on a regular basis, like a good prayer life. You can't just like do it at Christmas. something that you need to practice on a regular basis. And the 18-40-60 rule, again, is very helpful for anxiety disorder people. You're 18, you worry about what everybody's thinking of you. When you're 40, you don't care what anybody's thinking of you. And the truth is that when you're 60, you realize nobody's been thinking about you at all because they've been thinking about themselves. When I have patients that have panic disorders, I write this out on a prescription. 1, don't leave. If panic disorder patients leave, they don't ever come back. The anxiety begins to take control over them. Now, leave if it's dangerous. But if it's not dangerous, say you're like at the mall, you're going to have a panic disorder and they leave, it's like, don't leave. Start breathing with your belly, slowly, deeply, mostly with your belly. Kill the fortune-telling ants, you're probably predicting something bad is happening. And then medicine. But don't think of medicine first. It's not a good idea. This is one of the computer screens in our biofeedback equipment. And we're hooking up their belly and their chest. And we can actually watch it moment by moment, how they breathe. And we see that nice and deep, slow, very cool. And then with their eyes closed, I went, think about the last time you were angry. And look what happens to their breathing. Completely decompensate. Now, just knowing that, getting feedback on that, they can change it. So when they feel anxious, they can go, I've practiced diaphragmatic breathing. 5 deep breaths, they're already beginning to feel better because now they have oxygen. See, when you're not breathing, no oxygen, your brain's unhappy. Because your brain cells start to die after 4 minutes if your brain doesn't get proper oxygen. The dark side of anxiety, depression, and bipolar disorder, suicide, is very common. Sometimes people cut on themselves, often to mask pain or to cover abuse. If you have a cutter, you need to screen them for dissociative identity disorder or multiple personality disorder. Many cutters have underlying dissociative disorders. Violence is common, and drug abuse is common. These are family illnesses. Anxiety and depression increase divorce. They increase domestic violence. It's important because they run in families to evaluate family members and include them in the evaluation and the treatment process. Because if the spouse is bonded to you, the spouse may help them get you the client to their appointments. The spouse has never met you, and you're dealing with somebody who goes home and says, oh yeah, the therapist thinks you're a bozo. The spouse will undermine the therapy. So I think it's good that you get people in and at least meet them and say hi, and you get the information that the other person has, because often patients do not report things as accurately as you would like. How's everything? Great. And it really may not be great at all. Well, what do you do if things don't work? Well, 1, the diagnosis might be wrong. Or you're treating them with depression, and what they have is the lights are low and everything is low, and you're treating them with an SSRI. So you might have the wrong type, or the wrong medicine, or there are things that interfere with treatment. Like they're taking their medicine with orange juice, and orange juice can sometimes deactivate the medicine. Or they're taking generics when brand name works better for some people. I mean, for some people, generics work better. For some people, brand name works better. In my mind, they're just different. After being a doctor for 20 years or 22 years, the medicines are just different. Sometimes they don't follow through enough. They go and they don't come back. They go and they don't come back. Or they try to cut corners. So just some things to think about. Depression increases your risk for Alzheimer's disease. Untreated depression doubles the risk. Now, sometimes untreated depression, as we talked about, can masquerade for Alzheimer's disease. So if you're working with the elderly, it's a very important concept to understand. Now, why is exercise good for mood? Because it increases a whole bunch of good things. Blood flow to your brain. It increases your neurons' ability to deal with stress. It increases serotonin to the brain. The brain deals better with free radical formation. everything is better with exercise. Okay. So in summary, anxiety, depression, bipolar disorder, they're highly treatable if you understand the subtypes. Accurate diagnosis can make a dramatic difference, save money, lives, improve generations. They're wonderful people to treat because they usually get better. Well, with adult ADD, there are a lot of people who are not properly trained, a lot of therapists, psychologists, and psychiatrists, and so they get diagnosed as personality disorders. They get diagnosed as having bipolar disorder, even though they've never been, hey, I'm going to wear this, Jesse. So bipolar disorder, personality disorders, anxiety and depression, they get all those. And those treatments don't make them better. Our clinic does medicine and supplements. We'll recommend other treatments and try to help people find resources to get them. Because, you know, we think our job is informed consent. Is to tell you what we think the problem is and give you the options to work on it. And, you know, some people won't take medicine. So you can't go, oh, well, you have to do that. You just have to go, well, these are your other options. And these are the pros and these are the cons of each option. And you always want to stay that way with your clients. You don't want to tell them what to do because, we have enough trouble being responsible for ourselves. But you want to give them good information. Tommy had a left temporal lobe problem. That was his primary problem. So with left temporal lobe problems, we use anti-seizure medicine to try and stabilize them. And isn't it interesting, in the last 30 years in psychiatry, we've been using more anti-seizure medicines, almost more than neurologists use. Because what we find is they stabilize mood. They decrease temper. They decrease anxiety. Depakote, Lamictal, Neurontin, and so on. Type 4 is one of the most common types of anxiety and depression. This is the type that responds to serotonin medicine. Almost all of them. If you're over-focused, almost always you have both anxiety and depression. Say that again. It manifests both ways. The question is, how will this play out with a child pornographer? They get stuck on it. They just can't shift. And so even though they hate themselves, because a part of them knows it's wrong, they go back. It's like, have you ever been bowling? And in the bowling alley, there's a reset button. And, say the pins don't come down or whatever, and you go, okay, hit the reset button. For these people, it's like the reset button is stuck. And so you can't do anything because you're getting those images back over and over and over again. I have a friend who works at the Buena Vista Correctional Institute. He's the medical director there in Colorado, Buena Vista, Colorado. And after he listened to me, he started putting all of his child molesters on serotonin medicines. And he just had some great stories about how they would stop thinking about it all the time. So the question is, in the court system, if you can demonstrate that this is a medical problem that potentially has a treatment, how do you judge them? What do you do? As in Los Angeles 2 weeks ago in a death penalty case. And this guy, one of the two murderers he committed, he was in a bar. And he was Hispanic, and somebody disrespected him. And his machismo got all out of whack. And he went home. And he got a gun. And he came back. And he shot him dead. And the prosecutor went, he planned it. And I'm up there. He had really hot cingulate gyrus. And I went, it's sort of like a vinyl record, remember vinyl records? That has a big scratch in it. And it's like all he could hear was, he disrespected me. He disrespected me. I'm going to kill him. I'm going to kill him. That's not good planning. I mean, what I said in court, I said, it's bad planning. He's here. Right? He didn't even know this person. Right? One would think that is bad planning. He got life without the possibility of parole. They didn't kill him. Very happy about that. Now, I mean, at some point, you still have to hold people responsible. But there are levels of responsibility. You know, we do not all have the same level of free will. I wish it was so. It would make the court system and judgment so much easier. But that's why the Bible says, don't judge other people, because it's complicated. If somebody doesn't have too much activity in the anterior cingulate, and they take an SSRI, so the question is, how would it affect them? Well, it would sort of calm everything down. So say it's normal to start in front. Taking an SSRI will calm it down even further. So they're going to have motivational problems. They may have cognitive problems, concentration problems. So if you give somebody who typically has ADD an SSRI, you take down their anxiety, but you also take down their frontal lobe. So they're worse, but they don't care that they're worse. The question is about Elavil. There are a lot of side effects with it. Now, some people do great with it, and they don't have any problem. Dry mouth, constipation, blurred vision. Never take an overdose of it, because it's nasty if you do. But you know, periodically I'll use it for headaches as well, because it tends to be. Does it work for you? If it works, sometimes it'll dry up their bladder. They get an atonic bladder, doesn't, you know, can sort of settle it down. Yeah, at least as antidepressants, we have many better ones.